So India is seen as the pharmacy of the world. First thing we have to remember is we serve a population of 1.4 billion. So that's the primary role to ensure that is served really well, and the industry has outshined, especially during and post-COVID. On top of that, it is about coming up with more and more complex treatments which we can serve, because standard generics we've been supplying now for 20 plus years. We need to keep moving up the value chain, whether that is on complex, whether that is on incremental innovation, and eventually on novel. So that's the direction of travel. If I see the kind of things that we are working on, we're looking at mRNA technology, where we've made investments in Germany. We're working on stem cell treatment. We've in-licensed an inhaled insulin for India. We've launched novel antibiotic for the first time here. So these are the kinds of things which we keep on doing to go up the value chain, and all the capabilities add together because it's a very complex ecosystem. So you need all the different capabilities, you need the right partnerships for an individual company to move up the value chain, and therefore for pharma industry coming out of India to move up the same value chain. So technology is helping in a number of ways. One is product technology, where we make it easier for products to be used by the patients, and ultimately it's the patient outcomes which we care for. So we have, for example, a breath actuated inhaler which makes it easier for the patient to use that. We also have digital technology which is becoming increasingly prominent. We are deploying that for the right use cases. So mostly for point of care diagnosis, where we see a lot of applicability. For example, a face scan where you can diagnose 20 parameters before the patient even walks into a doctor. We have handheld spirometers which is improving the diagnosis and helping early diagnosis. We have a point of care diagnostic. So all of these initiatives on the diagnostic side is where the technology becomes very important to do it at the right time, to give the reliable outputs, and to do it at scale. Because we do serve a large population, so the massification of any of these technologies becomes extremely important for us to have a real impact. So we have been championing the cause of awareness and the right treatment to be followed. We have a flagship campaign called Berog Zindagi, which we've been running for 20 years now. Last year we moved it on social. We got 25 crore views. So it's a big mass initiative. So early diagnosis is definitely very, very important. On top of that, we are bringing the diagnosis easier, like I mentioned, Spirify. And now we've used a digital tool where we've come up with an app-based solution. So even when the patient has gone to the doctor and they want to stay connected on all the ecosystem, they want to be compliant on their treatment, they also want to practice some breathing exercises, they want to be aware of when the next diagnosis has to happen, when the next consultation has to happen. We've offered a digital solution. Happy to say we've already got 1 million downloads on that. So there's a number of ways in which we are closing the loop to ensure that the patient is getting the right treatment and also adhering to their treatment, because the causal factors are there. Environment and pollution is one of them, but there are actually other factors as well, which makes the disease very different in terms of its incidence as it is compared to the developed world. So for example, in India, 70% of COPD is not in smokers. Whereas globally it is the other way around. So for us, we need to make the awareness go several notches higher, whether it is for COPD, whether it's for asthma, and especially in times like this where there's a high incidence of pollution in the north part of the country. The awareness needs to be very high, so patients seek the right treatment options at the right time and therefore are protected.